The University of Tennessee Medical Center is our region's only academic medical center. Our mission is to serve through healing, education, and discovery. Our goal is to share the knowledge of our physicians and staff in these health education videos as you make healthcare decisions for yourself and your family.
Weight loss surgery is extremely helpful, but we require that people understand that it's really a tool. One of the biggest misconceptions is that after you have weight loss surgery that you'll never have to really consider what you're eating and that it will last forever and be able to take over the choices that we make interpersonally. Weight loss surgery effects will not last forever. Many of you may already know people who've had weight loss surgery in the past and regained some or all of their weight. So one of the most important parts about understanding and going on this endeavor for weight loss surgery is that we understand how the process works and what behavioral changes and changes we have to make the surgery work. It's not a magic pill, it's not a panacea, it's not something that's just going to work for you without you learning how to use that tool. It's like getting power tools and not reading the directions. So weight loss surgery itself will not last forever without you making it work for you. Because weight loss surgery has so much to do with our present culture and lifestyles in the United States, psychological evaluation is imperative prior to weight loss surgery. It's required by most insurance companies. We require it at the University Bariatric Center here at UT because people understanding that this is not going to be a quick fix. It is not the easy way out, which is one of the most common things people hear when they're endeavoring upon weight loss surgery. There is nothing easy about this. There are tons of psychological changes that happen after surgery, cultural changes, family changes, because so much behavioral change is required after surgery. So we require that the person have a psychological evaluation prior to surgery, so A, they have that support in the system already after surgery, but additionally so that they really understand that the operation itself is just the mechanics, and the other 90% of this is how the patient deals with food and what their relationship with food is. Is food your best friend? Is food your reward system? Is food your only cultural thing that you do with your family? It's what we do in America. We have food at Christmas, we have it for birthdays, we have it because report cards are done well. So we've got to start looking at what we use food for. Rarely do Americans eat to live and use food for nourishment. We use food for tons of other things, socially, in families, as well as in the culture. So the psychological evaluation is a core foundational part of learning how to make this weight loss surgery work for you. Weight loss surgery does help significantly with food cravings. The gastric band does not help with cravings all that well, but the gastric sleeve and the gastric bypass do help with food cravings. Part of the stomach is removed and cut off from the rest of the system so that certain chemicals are no longer in your body to cause you to crave. That craving respite, we'll say, lasts for about 12 to 18 months. And so during that time, learning how to make the other changes that you need to do in order to make weight loss surgery successful is real imperative that we learn how to do that. Many times, people who have loved milk products in the past will not like milk products, or who have craved meat in the past will not like meat after surgery. So there's no way to map how the cravings will change, but cravings very frequently change. And that's usually a really good thing with people who have had a lot of food cravings and eat because they have to have chocolate or because we have to have a French fry or a burger. And so the cravings will change, but that time period is what we call the honeymoon, and that lasts for about 12 to 18 months. One of the many misconceptions about weight loss surgery is that after I have the surgery, I'll never really have to think about food again, that I will magically become thin, not have to work with it any, and that's a very major misconception. After weight loss surgery, in fact, food becomes more of an issue because the planning about what you can eat, how often you need to eat, how much you eat is extremely important. And if you don't have that plan in place, then being successful is going to decrease. Your chance of being successful will be significantly decreased because you haven't had the plan and haven't figured out what you're going to eat after weight loss surgery. So the very popular weight loss programs that we already have are excellent to use post-operatively, because then you've got the tool of the weight loss surgery where your cravings have decreased, the ability to take in so much food has decreased, and you have already have the ability to make those changes that some of those other plans ask you to do. Remember, after weight loss surgery, your portion is only a half a cup. So kind of think in your mind, what is a half a cup? Get out a half cup measure. Remember that all of Christmas dinner is going to fit into a half a cup at the beginning, immediately after weight loss surgery. And that is difficult to understand. And so yes, you still have to keep thinking about weight loss surgery, and you have to make much better choices. We have to begin practicing behavior changes prior to surgery, because for however many years, in many ways, we've become brainwashed, slightly from the media, slightly from ourselves, about how much we're supposed to eat, what is a portion, how much food that we need to take in. For instance, if you go out to eat and you get a 16-ounce steak, remember that is 4 meals. That is enough for 4 meals. And so learning how to make eat smaller meals, make better food choices is extremely important so that you can be successful after surgery. And if you don't start doing that before surgery, however many years old you are is how long you've been having the bad habits. And that's where we have to start changing those habits now. A, to just learn what they are, and then B, so that they can become part of our daily culture and daily life. So learning how to chew. Americans don't chew. Most of us chew 4 times and then swallow. Try to chew your food for 20 times and eat. Enjoy your food. Don't just inhale it like most of us do. Decreasing the portion size, I've already mentioned. Learning how to sip and not just gulp things down. Very frequently, we're not mindful about what we're eating. And so learning how to think through what we're eating and why we're eating it, how we're chewing it, is extremely important for success after weight loss surgery. But if we don't start to work on that now, there's no way of our coming out of the hospital and having this magical cure that, okay, I'm going to know how to eat properly after surgery. That is why we require that at the University Bariatric Center, that you start to make those changes prior to surgery.
We hope you'll join us for another medical moment. Visit utmedicalcenter.org or call the Healthcare Coordination Office at 865-305-6970 to learn about services available at the University of Tennessee Medical Center.